Hello everyone. My name is Tomoko. I'm a research fellow at Tokyo Metropolitan Institute of Gerontology. In this symposium, we would like to discuss challenges in adapting emerging technologies in long-term care. In the beginning, I would like to begin with social context of technology implementation in long-term care. I will introduce the situation of family care, long-term care insurance program, and social policy in Japan as an introduction of our research projects. Let me begin with the brief backgrounds of long-term care in Japan. This is a graph about the numbers of older adults with care needs in Japan. Since we introduced long-term care insurance program in 2000, we have the numbers of older adults who require care since then. At that time, the number was about 250 million who requires care, but it now reaches 700 million of older adults, which is about 18.6% of older population and 5.3% of total population. When we see the details of older adults who require care, 80 to 90% of are those whose age is 75 years and older. So when we think about long-term care, we focus on 75 years and older rather than 65 years and older. These are Japanese population pyramid in 2015, 2025, and 2050. You can see the older adults are expecting more as baby boomer gets older, but in fact, the older adults whose age is 75 years and older are expected to increase. And that is why long-term care is an urgent issue in Japan to solve. We introduced long-term care insurance mandatory program in 2000. We pay premium about $60 depending on where you live when you reach 40 years and old. The eligibility starts when you get 65 years old, but you are also eligible when you have special diseases such as cancer, dementia, diabetes, and so on. When you use some services, you pay 10 to 30% of out-of-pocket fee, depending on how much money you earn from social pension or any other financial income. The services include both institutional and home care, such as personal care at home, daycare, short-stay care, as well as preventive services. These are the examples of daycare services. Daycare services is provided to older adults staying at home, aiming the maintenance of both physical and cognitive functions of older adults with care needs, as well as caregivers' respite care. Our public long-term care program enables where service users select the type of services and service providers. For example, services are now provided on depending on older adults' long-term care needs, and selecting and using services are the rights of care recipients. Care plans are decided under the integrated medical and welfare services so that care recipients can use comprehensive, appropriate, and ongoing services depending on the individuals. Services are provided by various organizations, such as public organizations, private companies, or NPOs, which leads to increase of service supply and improvement on the quality of services. But we are also facing the financial burden on society as older adults increases. What you see here is the cost of Social Security, including long-term care, welfare services, social pension, and medical cost. In particular, red line and bars show the long-term care cost, which is expected to increase, as well as medical costs in blue bar and lines. Another challenge that we face to sustain the mandatory long-term care program is challenges at long-term care workforce. There are always shortages of human resources in the field of long-term care. For example, Every year, job turnover is 16.6% due to their temporal employment status or lower wage. Research has reported physical and psychological caregiving burden among care workers, such as 60 to 80% have back pains and their stressful work environments. Another issue here is family caregiver. We are facing a big transition of family caregiver for the last 30 years since we introduced long-term care insurance program. Traditional three-generational household to support care recipients has reduced, but single or aged care recipients household increases. We also see more unmarried caregivers, which means they're having less support and the financial difficulty. We see increases of male caregivers, and these diverse caregiving arrangements make it hard to expect family as a traditional roles of caregivers. With these backgrounds, the Ministry of Economy, Trade and Industry and the Ministry of Health, Labor and Welfare collaborated to formulate the priority areas to which robot technology is to be introduced in long-term care of older adults. The two ministries will cooperate and aim for the development and commercialization of robotic devices for long-term care. The first area focuses on the lifting aids, which include wearable devices using robot technology to provide power assistance to caregivers, and non-wearable devices for lifting care receivers. The second area focuses on the mobility aids, which include walking aid devices using robot technology to support older adults, walking outdoors to secure safe carrying of loads, and walking aid devices for indoors. The toilets aids are focused, such as adjustable position toilets using robot technology or alarm system for calls of nature. Another area focuses on monitoring systems for people with dementia, which include detecting when older people fall over, wandering, and so on. Bathing with devices to support older adults in the series of motions required for getting in and out of bath, as well as companion aids, are also encouraged to introduce. The benefits of using technology is autonomy and the dignity of care recipients. People would be able to live independently as much as possible even after people require long-term care and enable aging in place. It also includes family and care workers' care environment to assist overburdened care work, such as kneeling position, transferring recipients, which lead to reduced physical and emotional burdens of caregivers and care workers. Also, monitoring system can tell patients move, fall, or vital data changes, which may collect data and predict home accidents, such as falling, wandering, aspiration, any types of accidents, by sharing the care record in real time among care workers and family. However, there are, of course, issues introducing technology in long-term care. There are big gaps between developed technology and real needs in care settings. Also, care workers have not valued to install the technology, which is because they invest their money, their time, or their knowledge, and they also adjust their work style to new technology, but they don't really feel they are helped by technologies sometimes. There is discussion that technology may substitute human care workers is sometimes offensive among care workers. So we need to clarify technology won't substitute human care workers, but compensate their work. However, not only at care settings, but also older adults, their family or society could trust the integration of technology in long-term care setting. That is the question. So we have our ongoing project focusing on older adults, family caregivers, care workers, and developers. And we are trying to understand what matters for each of them to implement technology or ICT in long-term care setting. So now my coworkers are going to explain. Thank you. So now my coworker, Dr. Hiroyasu Miwa, from National Institute of Advanced Industrial Science and Technology, is going to present modeling of preference for technology use in nursing care and experiences with intelligent technology.
Hello everyone, I'm Hiroyasu Miwa from AIST Japan. My talk is Modeling of Preference for Technology Use in Nursing Care and Experiences with Intelligent Technology. As Dr. Wakui presented, the aging rate in Japan is highest among countries and is expected to increase in the future. Therefore, the future shortage of human resources in nursing care services is a serious social issue. For the sustainable provision of nursing care services, the use of intelligent technologies such as robots, AI, and IT are expected to offer a solution to the issue. For example, power assist robots, communication robots, sensors for monitoring, and care record systems. However, the adoption rate of numerous technologies in Japan is less than 10%, except for the nursing care record system. Intelligent technology has not been widespread in Japan. Against this background, we assumed that we could promote the use of technology by clarifying the model of preference for technology use. Then, we aimed to model the preference for technology use in nursing care from the perspective of experiences with intelligent technologies. To achieve the purpose, the online survey on the attitude toward nursing care and technologies was conducted during August 2020 in Japan. This table shows the distribution of the age and gender of respondents. 4,457 respondents were included in the analysis. The age, gender, and region distribution were not biased compared to the population composition. The survey consisted of a questionnaire with 39 questions in total, including preference for style of nursing care and technology use in nursing care, experience of IT tools and intelligent technologies, trust in intelligent technologies and social security service, and personal characteristics. In this presentation, we analyze relationship between preference for technology use and characteristics, use experience with intelligent technologies and characteristics, trust and use experience, and trust in intelligent technologies and preference for technology use by using the results of these 15 questions to model the preference for technologies from the perspective of experience with intelligent technologies. Firstly, this shows the result of preference for technology use in nursing care. The respondents were asked their preference for technology use in 10 types of assistance, such as bathing and dressing. Each bar shows the percentage of respondents. 58% responded assistance by human and technology, 26% assistance by human, and 15% assistance by technology in average. And we compare the differences in the preference for technology use in nursing care according to personal characteristics using the classical voice test and the chi-square test. As a result, we confirmed that those who preferred assistance by human were significantly more likely to be older, have a lower income, and have a lower educational background. Those who preferred assistance by technologies were significantly more likely to be younger and have a higher educational background. And those who preferred assistance by both humans and technologies were more likely to have a higher educational background. Secondly, this shows the result of trust in intelligent technologies. 3 commonly used intelligent technologies, namely cars with automatic braking, online banking services, and AI assistance systems, were presented to the respondents instead of technologies used in nursing care. And the respondents were asked their experience of these technologies within the past 3 months and their trust in these technologies. As you can see, more people with use experience significantly trusted each intelligent technology. And we compare the differences in the use experience and trust in each technologies according to personal characteristics in the same with previous analysis. As a result, we confirmed that those with use experience in each technology were significantly more likely to be younger, have a higher income, and have a higher education background. And those who trusted each technology were significantly more likely to be older, have better health condition, and have a higher educational background. In addition, we determine the correlation coefficient between the number of trusted technologies and the number of assistants for preferences. The result was plotted on this figure. We confirmed that the number of trusted technology and number of assistants by both human and technology exhibited a weak positive correlation, and the number of trusted technology and number of assistants by humans exhibited a weak negative correlation. Those who trusted more technology were significantly and positively correlated with the technology used for the assistance. Finally, we compare the difference in the number of preferences for style of nursing care between the trust and the distrust of each technology using one-way ANOVA. We confirmed that those who trusted each technology selected a significantly decreased number of assistants by humans and increased number of assistances by both human and technologies. And those who trusted online banking services had a significantly increased number of preferences for assistance by technologies, whereas there were no significant differences in it among those who trusted car with automatic braking or AI assistance systems. These results reveal the two aspects in terms of preference for technology use in nursing care, trust in intelligent technologies, and personal characteristics. The first point is that those who trusted intelligent technologies had significantly more experience with technology, higher household income, and higher educational background. The second point is that those who trusted intelligent technologies that are commonly used in daily life were significantly more likely to prefer technology use in nursing care. These findings suggested that people with higher education and more financial means may have greater opportunity to use and experience new technologies, and consequently, they are more likely to exhibit higher trust in technologies and also in brand new technologies for nursing care. Finally, the preference for technology use in nursing care would be higher. In addition, automatic braking and AI assistants have higher interactivity between technology and humans, because the former functions as a physical interaction between a driver and a vehicle, and latter provides information to a person through verbal interactions, while the online banking services are one-way system from humans to systems. And we found that those who trusted technology with high interactivity preferred more interactive assistances and selected hybridized assistance between humans and technologies. This shows that the preferences for assistance was supposed to be related to the interactivity between technology and humans. In conclusion, we conducted an online survey of Japanese people to model the preference for technology use in nursing care. And we proposed a model which expressed the preference for technology use in nursing care based on personal characteristics, use experiences, and trust in intelligent technologies. Then, we considered that The preference for technology use in nursing care could be expressed using the interactivity between technology and humans and varying trust in technology. In the future, analysis of causal relationship among factors using logistic analysis, structural equation model, and path analysis is necessary to improve the proposed model. This is acknowledgement and thank you for your kind attention.
So now we move to Dr. Tomoko Ikeuchi from Tokyo Metropolitan Institute of Gerontology. She's going to talk about preferences for human versus technology care assistance by Big Five personality traits.
Thank you for the introduction. My name is Tomoko Ikeuchi. I'm from the Tokyo Metropolitan Institute of Gerontology in Tokyo, Japan. In this presentation, I will discuss a study of the preferences for human versus technology care assistance by Big Five personality traits. Older population aged 65 and over has increased rapidly in the past decade in Japan. Now 28% of the total population is those aged 65 and older, and it's projected to increase to nearly 40% by the year 2060. The life expectancy has also increased. It's almost 82 years old for male and 88 years old for female. With the increase of older population and the longevity, long-term care needs also increased. However, the number of care providers did not increase to cover these care needs. Now technology use in care settings has been promoted by the Japanese government, and it has increased but slowly. Implementing care technologies in home and institutional settings has been a challenge. Several factors such as high cost, management issues, psychological barriers, for example, distrust of technology, professional norms on quality of care have been discussed. This study focuses on the psychological aspect that may be influencing the implementation of care technologies in home and institutional settings. In implementing care technologies in home and institutional settings, people's preferences for technology or human assistance in care needs are important to consider. The preferences may differ by personalities. However, studies related to the preferences for human or technology assistance in care needs by personality traits are very limited. The purpose of this study is to examine the association of personality traits and preferences for human or technology assistance in different care needs. The method, we collected data by online survey conducted in 2020. The study analyzed 4,457 participants aged 40 to 89. The median age was 60.5 years old. 52.8% were female, and all resided in Japan. Measures. We used the 10-item personality measure developed by Gosling to assess the 5 major personality traits that are extroversion, agreeableness, conscientiousness, emotional stability, and openness to experience. The questionnaire includes 10 items of personality traits that participants rated the extent to which the pair of traits applies to them. Participants were also asked whether human, technology, or both assistance would be preferable if care were required with their daily activities, such as bathing, dressing, toileting, eating, taking medications. Age, sex, years of education, and care experience were also reported. For statistical analysis, depending variables for each activity of daily livings, such as bathing, dressing, and toileting. Independent variables were the scores of five major personality traits. Explanatory variables were age, sex, education, and experience of providing care. We ran a series of linear regression for each activity. The result? These are the personality trait scores divided by sex. The scores of extroversion, agreeableness, and conscientiousness and openness to experience were significantly higher among females than males. Here are the results of linear regression for each activity. In this graph, minuses indicate higher preferences for human assistance, and pluses indicate higher preferences for technology assistance. Personality traits such as extraversion, agreeableness, emotional stability, and conscientiousness were associated with higher preferences for human assistance in daily activities such as bathing, dressing, toileting, transferring, eating, and taking medication. Older age was also associated with higher preferences for human assistance in all activities. Personality traits of openness to experience was associated with higher preferences for technology assistance for dressing, transferring, toileting, and eating. Being female and longer years of education were also associated with higher preferences for technology assistance. Longer years of education was a stronger predictor. 35.3% of participants reported having experience in providing care to others. In summary, the result of linear regressions show that preferences for human assistance in daily activities were associated with personality traits of extroversion, agreeableness, and conscientiousness, and emotional stability, and older age. On the other hand, preferences for technology assistance in daily activities were associated with personality traits of openness to experience, being female, and longer years of education. The implications from the study: people with extroversion, agreeableness, conscientiousness, emotional stability personalities may prefer human interactions with receiving help with daily activities. People with openness to experience personality may prefer technology assistance with their daily activities. Personality traits may be another contributing factor to people's care preferences that need to be studied. Thank you for listening. If you have any questions or comments, please email me. Thank you very much.
So lastly, Dr. Kentaro Watanabe from National Institute of Advanced Industrial Science and Technology is going to talk about what promotes or hinders care technology integration. Technology developers view.
Okay, thank you for introduction. Hello, I'm Kentaro Watanabe from ASD, National Research Institute in Japan. And my talk is focusing on the technology developer's view. The topic is what promotes or hinders care technology integration. As a kind of introduction, as we've already kind of discussed, our topic is aging society. Of course, aging itself is not a problem, but it causes several challenges in the sustainability of welfare systems. And now there is a kind of increasing expectation toward care technologies. And a lot of studies are being held about technological R&D and the impact assessment of technologies, and also how to develop and integrate technologies, such as kind of involving the customers. But interestingly, there are few empirical studies on technology developers' business practices. So the focus of this research is what are the factors which promote or hinder care technology integration into the elderly care settings from the technology developer's perspective. Based on this research question, the research approach here is a case study approach. We investigated 6 business cases in Japan. And the main source of this study is from the semi-structured interviews where the managers, executives, and also the individuals are professional of the care technology businesses. And in addition to that, we use some supplemental materials, which includes documents provided by the interviewees and also corporate websites and technology websites of these types of publicly available information. And after collecting the data, we conducted a qualitative thematic analysis. We adopted inductive coding approach, focusing on the research questions and categorize the kind of ideas to the promoting and hindering factors of care technology integration. So here I show the case description. So there are a lot of cases, including the different sizes and a variety of products, and both B2B and B2C businesses. So with such a kind of variety of cases, we discuss what would be the kind of a promoting or hindering factors. And here I show the kind of a preliminary findings of the promoting factors. The first 6 are mainly about how to engage customers in care technology integration, which include cooperating with champion customers, customer education, emotional engagement, service system arrangement, service through network, and corporate or technology branding. In addition to it, the care technology developers need to create their capabilities in providing a better technology and services. From this aspect, there are 2 factors mentioned, which include employee education, knowledge sharing, and also the solution exploration. And recently, only the care technology developers can provide a better technological solutions, but also the kind of ecosystem development is more and more important. And about this aspect, channel development and utilization of external support, especially the public support, are kind of mentioned. And here I'd like to provide some highlighting comments. The first one is about cooperating with champion customers. This kind of a word, champion, from the kind of one of the comments from the case A interviewee, and which mentions, it is important to proceed with champions together who want to improve the current quality of care. So here, the champion implies that the customers with a high motivation in improving their services and the kind of quality of care and quality of life of the seniors and their families. So with such kind of a such a customers with such motivations, they are kind of eager to kind of utilize the technologies in a proper way to better services and better quality of life. And also, they are kind of willing to provide information on their kind of result to the other stakeholders, which is very much helpful for the care technology developers. So from this aspect, cooperating with champions are very much important. And the second comment is about customer education. Of course, the training and education is a kind of a very essential part of the services for the better utilization of the technologies. But specifically here, the comment is about the kind of a limitation of technology. So the comment said, I tell customers what the technology can cannot do, and that it cannot do everything. So this means about the kind of how to this kind of is a kind of a controlling comment of the over expectation towards technology. So ordinary citizens or care service providers tend to have a kind of illusions about the high techs. So, but actually the technology need to be better utilized in the certain care settings. So in this aspect, service providers need to have a kind of a sufficient ideas about what technology can do or cannot do, then they can provide a kind of better service using technology. So technology developers consider that is very important point. And the third comment is about the emotional engagement. So here is a one comment that is, it is a kind of our goal to let care personnel say, oh, it is cute. So technology is, of course, a kind of something to provide certain functions, but not only functions, but also the engaging emotionally is very much important to trust technologies and also and accept it as a kind of part of the services. So from this aspect, the emotional engagement is considered a kind of an important point for promoting technology integration. And the fourth thing is about the serving through network. Under the COVID-19 impact, more and more kind of a remote services are kind of considered. And in the interview, one of the interviewees comment, there is something like remote training has been accepted and our work has become more efficient. Those who were absent from the session can check the recorded material. So it means that the kind of another way of service can be kind of realized. And also this type of trend is kind of promoted under COVID-19 situation. And by using a kind of such kind of digital services, the technology can be kind of utilized in a different way. So that's a kind of typical, no, it's kind of a special things under the COVID-19 situation. And we also find some kind of hindering factors, including busyness at care workplaces, privacy, lack of available data, misunderstanding of technologies, lack of acceptance in technologies and IT literacy, difficulty in evaluating the impact of technologies, insufficient performance of technologies, and getting bored of technologies. These type of things should be tackled for the care technology integration also. So finally, I'd like to provide some concluding remarks. So today I mainly talk about kind of in-depth cooperation with the customers. And also I kind of mention about ecosystem aspects. So such kind of a deep cooperation to the disseminating in a wider processes, that'll be a kind of a very kind of a challenging issues, and the technology developers are trying to adapt to this type of shift. I think that's a kind of one important issue. And the second aspect is about the emotional side. So not only the kind of developing the good functionalities, but also the how to engage the customers emotionally through technologies or through services. That's a kind of important things for the technology integration. And third point is about the service system thinking from my wording. So technology is a kind of a part of the whole services, and other service processes or the kind of how to utilize it is very much important. So this whole total system understanding is also very much important for the technology integration. And we also kind of are continuing the work on, and also we are kind of planning a kind of future work of that. So one is about the cross-case analysis of this study, and also we conducted a large-scale survey on that. So these will provide a kind of better understanding of how technology developers are working for the better care technology integration. So thank you very much.